Welcome to Living Beyond the Invisible, where we shine a light on the challenges and experiences of living with invisible disabilities. I'm your host, Heather, and in each episode, we'll explore different aspects of life with invisible disabilities, from physical health to mental wellness and everything in between. Whether you're someone living with an invisible disability or seeking to better understand what struggles those of us who are living with them go through, you're in the right place. Welcome back, friends. This is our first episode of our new series on autoimmune diseases. So today we're diving into a condition that affects millions of people around the world, and that is rheumatoid arthritis, which is often abbreviated as RA. And I do want to note that I will likely switch back and forth between saying rheumatoid arthritis fully and shortening it to RA. It's just how my brain works. Please bear with me. Before we get started, I want to just say that I did quite a bit of research for this topic, but like I stated at the beginning, I don't have RA, so I can't speak from experience here. I just hope that I am doing it justice. So let's jump right in. Like many invisible illnesses and disabilities, rheumatoid arthritis is often misunderstood. Many people think arthritis is just part of aging or something that causes mild aches in the joints. But RA is a much more complex condition. Unlike osteoarthritis, which I do have, and which is caused by wear and tear, rheumatoid arthritis is an autoimmune disease. This means that the body's immune system mistakenly attacks healthy tissue, specifically targeting the joints, leading to inflammation and damage. RA can cause severe pain, fatigue, and if not managed properly, lead to joint deformity and loss of function. It's a lifelong condition that requires comprehensive treatment, but many people with RA can live full, meaningful lives with the right support and care. In today's episode, we're going to explore what rheumatoid arthritis is, how it differs from other types of arthritis, and the ways it affects not only the physical body, but also mental and emotional well-being. We'll also talk about treatment options, lifestyle changes, and how to manage daily life with RA. Whether you're living with RA, know someone who is, or just want to learn more about this invisible illness, this episode will offer valuable insight into understanding the condition and supporting those who have it. So let's get started by breaking down what RA is and how it manifests in the body. The big question is, what exactly is rheumatoid arthritis? Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joints, but can also impact other systems in the body, such as the skin, eyes, lungs, and heart. Unlike osteoarthritis, which is, if you remember from my episode on osteoarthritis, it is related to aging and the breakdown of cartilage. RA, though, is an autoimmune disease, meaning the body's immune system mistakenly attacks healthy tissue. When the immune system attacks the lining of joints called the synovium, it causes painful inflammation. Over time, this inflammation can damage the cartilage and bone within the joint. The joints most commonly affected by RA are the small joints in the hands, wrists, and feet, although it can affect larger joints like the knees, hips, and shoulders as well. RA typically affects joints symmetrically. So that means if one knee is affected, it is very likely the other one will be as well. The symmetry is a hallmark of the disease and one of the ways doctors differentiate RA from other forms of arthritis. The exact cause of RA is currently unknown, but a combination of genetic and environmental factors is thought to contribute to it. Those who have a family history of autoimmune diseases are more likely to develop RA. Add to that certain environmental exposures such as smoking or a history of infection may also trigger the disease in individuals who are genetically predisposed. One thing that's important to note about RA is that it's not limited to joint pain. RA is a systemic condition, meaning it can affect the entire body. Many people with RA experience fatigue, fever, and general exhaustion, especially during flare-ups when symptoms become more severe. Some individuals may also develop rheumatoid nodules, which are firm lumps that form under the skin near the affected joints. Another key feature of RA is that it tends to come and go in flares, kind of like fibromyalgia. During a flare, symptoms become worse with increased pain, swelling, and stiffness in the joints. Flares can last days or even weeks, and in between flares, people may experience periods of remission when symptoms are less noticeable. So it is a little like fibromyalgia, but they are completely different. They're just similar with the flare-ups. However, RA is a progressive disease, meaning that over time, if left untreated, it can lead to significant joint damage and disability. Now that we've covered the basics of what RA is, let's talk about the differences between rheumatoid arthritis and osteoarthritis, which is often mistaken for RA due to very similar symptoms like joint pain and stiffness. It's easy to confuse rheumatoid arthritis with osteoarthritis, especially since both involve joint pain and stiffness. But the underlying causes of these two conditions are very, very, very different. Let's take a closer look at how RA differs from osteoarthritis. Osteoarthritis is the most common form of arthritis, and it's typically seen as part of the natural aging process. If you remember, I have OA in my spine. OA occurs when the cartilage that cushions the joints wears down over time, leading to pain, stiffness, and limited mobility. OA tends to affect weight-bearing joints like the knees, hips, and spine, and is often related to overuse, injury, or simply the wear and tear of daily activities. And if you again remember, mine is likely from a car accident and a fall I had when I was in my late teens, early 20s. In contrast, though, rheumatoid arthritis is an autoimmune disease, and the joint damage it causes is not a result of wear and tear. Instead, the body's immune system attacks the synovium, the lining of the joints, leading to inflammation. This inflammation not only causes pain and swelling, but can also lead to long-term joint damage if left untreated. Another difference is the pattern of joint involvement. As I mentioned earlier, RA typically affects joints symmetrically, whereas osteoarthritis might affect just one knee or one hip without necessarily involving the other. While osteoarthritis tends to develop gradually over time, rheumatoid arthritis can come on more suddenly, often starting with small joints in the hands and the feet. RA also has systemic symptoms like fatigue and fever, which aren't typically associated with osteoarthritis. I do have fatigue, but it's from my fibro, not my OA. Understanding these differences is crucial for proper diagnosis and treatment. So let's move on and talk about how RA affects daily life and the challenges faced by those living with the condition. If you are living with rheumatoid arthritis, it can be incredibly challenging, not only because of the physical pain and the fatigue, but also due to its emotional and psychological toll. RA affects every aspect of a person's life, from their ability to work and engage in physical activities to their relationships and mental health. Now, if you have been following along, you see that this is a very common theme throughout just about everything I've talked about. That is because invisible disabilities and chronic illnesses, they don't just take the toll of the physical side of it. It is also that mental, emotional, and psychological side as well. So you will hear me talk about that probably just about every episode and everything I talk about. So be prepared. One of the biggest challenges of RA is dealing with the unpredictability of flares. You might feel okay one day, but the next you're dealing with debilitating pain and stiffness that makes it hard to get out of bed. These flares can make it difficult to maintain a consistent routine or plan activities in advance. Many people with RA report feeling frustrated by the unpredictability and the way it disrupts their lives. Again, this is a common theme for those of us living with invisible disabilities. I am not downplaying RA because it is a horrible, debilitating illness, but I'm pointing out that if you live with an invisible disability, this is probably something you deal with, whether it's RA, whether it's lupus, whether it's fibro, whatever it may be, you're probably dealing with both of those things. And yet another common theme is fatigue. It is a common symptom of RA, and it often gets overlooked. People with RA frequently experience extreme tiredness even when they've had plenty of rest. This fatigue can be overwhelming and make it difficult to perform even simple tasks like cooking, cleaning, or running errands. For some, fatigue can be as debilitating as the joint pain itself. The emotional impact of living with a chronic illness like RA cannot be understated. Many people with RA experience feelings of depression and anxiety, especially when their symptoms are severe or when they feel like their condition is preventing them from living the life they want. The uncertainty of not knowing when the next flare will hit, coupled with the fear of long-term joint damage, can be emotionally draining. Work and social activities can also be affected by RA. Jobs that require physical activity, such as standing for long periods of time, lifting heavy objects, may become impossible to manage during flares. Even office work can be difficult if your hands or wrists are affected. As a result, many people with RA have to make adjustments to their work environment or reduce their hours, and some may need to stop working altogether. Social activities can also become more challenging. RA can make it difficult to participate in things you enjoy, such as going for walks, playing sports, or even attending social gatherings. The fear of having a flare or feeling too tired to participate can lead some people to withdraw from social activities, which can contribute to feelings of isolation and loneliness. Despite these challenges, many people with RA find ways to manage their symptoms and lead fulfilling lives. With that, we move on to our next topic, which is treatment for RA. While there's no cure for rheumatoid arthritis, there are many treatments available that can help manage symptoms, reduce inflammation, and slow the progression of the disease. The goal of treatment is to reduce the pain and prevent joint damage, as well as improve overall quality of life. The most common treatment for RA is medication. There are several types of meds used to treat RA, which include things like ibuprofen and other anti-inflammatory drugs. Corticosteroids, these are powerful anti-inflammatory medications that can provide quick relief during flares. However, they are not typically used long-term due to the potential side effects. There are also disease-modifying anti-rheumatic drugs. These are designed to slow the progression of RA by targeting the underlying immune response. Methotrexate is one of the most commonly used of this type of drug. Biologic agents, these are a newer class of meds that target specific components of the immune system involved in RA. Biologics are often used in combination with the disease-modifying anti-rheumatic drugs. That is a mouthful to say. And that is done for a more effective treatment. In addition to medication, physical therapy is often recommended for people with RA. A physical therapist can help develop exercises to improve joint flexibility and strength, which can help maintain mobility and reduce pain. Occupational therapy can be another important way of managing RA, as it can help people adapt their daily activities to accommodate their symptoms and avoid putting unnecessary stress on their joints. Lifestyle changes can also play a big role in managing RA. Regular exercise, a healthy diet, and stress management techniques like yoga or meditation can help improve overall well-being and reduce the frequency and severity of flares. Maintaining a healthy weight is also important, as excess weight puts additional stress on the joints. It is also important to have a strong support system when living with RA, whether it's friends, family, or a support group. Having people who understand what you're going through can make a big difference in managing the emotional and mental toll that RA can take. Many people find comfort in joining online communities or local support groups where they can connect with others who are living with RA, share their experiences, and exchange advice on coping with the disease. Some individuals also benefit from working with mental health professionals to manage the emotional challenges that come with any chronic illness. Therapy can be a valuable tool in addressing depression, anxiety, and the frustration that comes with having RA. This will help individuals find healthier ways to cope with their condition. Finally, let's talk about how to live your life with RA. Though living with rheumatoid arthritis can be challenging, I'm sure, it's important to remember that many people with RA lead fulfilling, active lives. With the right combinations of treatment, self-care, and support, it's possible to manage symptoms and maintain a quality of life. I know you're probably thinking, Heather, you don't know what you're talking about. You don't live with this. But I think those things are really important no matter what your invisible disability is, to remember that you can lead a fulfilling and active life. You just have to find what works. And the key to living with RA, so I learned in my research, is being proactive about your health. Regular doctor visits, keeping up with your medications, and listening to your body are essential. If you feel a flare coming on, don't push yourself too hard. Rest when you need to and allow your body time to recover. And at the same time, staying active is important, even on those tough days. Gentle exercises like stretching, swimming, or yoga can help keep your joints flexible and reduce stiffness. And yes, I do kind of know what I'm talking about there because it's the same thing with my flare-ups. I have to be proactive, and if I feel a flare, I cannot push myself too hard. So trust me when I say I understand how hard that can be. Diet is another important aspect of managing RA. An anti-inflammatory diet, which is rich in fruits, vegetables, whole grains, and omega-3 fatty acids, can help reduce inflammation and support overall health. Many people with RA find that cutting down on processed foods, sugars, and red meats help with their symptoms. It's a good idea to work with a nutritionist to find a diet that works best for your body. Stress management is also crucial. Stress can trigger or worsen flares, so finding ways to relax and unwind is vital. Whether it's medication, deep breathing exercises, or spending time in nature, finding what works for you is important. I'm not sure if it would help with RA or not, but for me, soaking in a hot tub really does help. Lastly, be kind to yourself. Living with RA is a journey. And there will be good days. There will be bad days. There will be days that are in between. But surround yourself with people who understand and support you. And don't be afraid to ask for help when you need it. So that brings us to the end of today's episode. Rheumatoid arthritis may be a chronic, lifelong condition, but it doesn't have to define you. With the right approach, people with RA can lead fulfilling, active, and meaningful lives. Managing RA is about finding the right balance, whether it's through medication, lifestyle changes, or support systems. Everyone's path will look a little different because everybody is different. If you or someone you know is living with RA, I hope this episode has provided some valuable insight into what the condition is, how it affects daily life, and the various ways it can be managed. Remember, you are not alone. There's a whole community of people out there going through the same thing, and there is always hope. Thank you for joining me on this episode of Living Beyond the Invisible. I hope you found the insights and stories shared today helpful and inspiring. Remember, living with an invisible disability is a journey, and together we can navigate the challenges and celebrate the triumphs. If you enjoyed this episode, please subscribe, rate, and leave a review. Your support helps me reach more listeners and build a stronger community. Don't forget to follow me on Facebook, Instagram, and TikTok at Living Beyond the Invisible for updates and additional resources. Don't forget to check out our Patreon, which I will have linked in the show notes. Until next time, take care of yourself and keep living beyond the invisible.